Hello, and thank you for joining us to prepare for a week of RLS Advocacy. Today, we will briefly review information in the prep packet. With us today is the RLS Foundation's Washington representative, Philip Goglis II, to discuss the Foundation's legislative priorities. Thank you for discussing this with us today, Philip.
Thanks, Clara, and thank all of you for continuing to tune into our videos and participating in the RLS Week of Advocacy.
What are the RLS Foundation's legislative priorities for 2021?
That's a great question. When we develop our legislative priorities, we look at different areas of work that we do with the federal government and see how we can continue to advance critical priorities on behalf of the RLS community. So first, we look at medical research. The National Institutes of Health is the premier research agency in our country. They support grants which go into research of RLS and helps us to better understand what are some of the causes of RLS, which leads to better possible treatments for restless leg syndrome, as well as provides us with key information to share with the medical professional community and with the patient community. For this year, we're asking for $46.1 billion for the National Institutes of Health and overall funding. Why that's critically important is because the more money that NIH has as a whole, the more money they're able to provide to every single NIH institute, which gives those individual institutes the greater ability to fund key research activities. We also have one of our priorities in the funding side is at the Centers for Disease Control and Prevention. Now, as we discussed in some previous videos, you have the National Institutes of Health, which does the basic science to help us get a scientific understanding. The Centers for Disease Control and Prevention functions as the agency that helps to spread the information out to the general public. I'm sure after a year of the pandemic, everybody is fully aware of CDC guidelines on any number of things, such as the distance apart or wearing masks. So the Centers for Disease Control and Prevention is critically important to be that agency that educates the general public. At the CDC, we are advocating for $5 million for the neurological surveillance program, and we're advocating for $5 million for the new chronic disease education and awareness program that was created last year. Why this program is critically important is because it provides communities such as ours the opportunity to work with the Centers for Disease Control and Prevention on receiving grants that would allow us to provide increased education to the medical professional community to help them better understand RLS, what some of the signs are, what some of the symptoms are, and to the patient general awareness public to help them understand the same thing. What are some of the signs of RLS? What resources are available to them, and to better equip the general public and the RLS community with new information that's released because of the research that's done at the National Institutes of Health. We also are supportive of including sleep disorders in the Department of Defense's peer-reviewed medical research program. Why that's important is because the peer-reviewed medical research program is funded currently at $370 million, I believe. And the only way that a community is able to access those funds is through being listed as a condition eligible for study. So because sleep disorders is listed, it allows our researchers to apply for grants through that program for funding. And we also are very much active in ensuring that the RLS patient voice is heard and understood when it comes to any conversation about opioid policy. We also want to make sure that Congress understands that restless leg syndrome is not a pain condition. So it's not the same for the number of chronic pain coalitions or organizations that are out there advocating for specific items. We as a community and as an organization are making sure that decision makers understand that our patients use low doses that never increase, and that we want to ensure that there is a safe harbor for our patients to protect them from any of the sweeping changes that may prevent them from maintaining their quality access to medications that have been determined with them and their doctor that are effective for them.
Great. Thank you for touching on that. That's a really important part of what we do here. What types of programs are available to increase education and awareness?
That's a great question. And I know that that was a long answer to your first question. So I greatly encourage everybody to review the prep packet that is available. There is a lot more information in that prep packet that goes deep into the background and provides more information about each of our legislative priorities and our requests and help you to better understand those. So I cannot stress it enough. Please review the prep packet because there's a lot of information there that we just can't touch here. And I encourage you to rewatch the videos as well in case there was something that you missed the first time. So as I mentioned, the Centers for Disease Control and Prevention have this new program that was created last year that focuses on education and awareness activities. And what this program allows our community to do is to compete for funding that would allow us to increase our education, again, with those medical professionals and our awareness with the general population. I'm sure that many of you have, in your journey, experienced a prolonged diagnosis or signs of symptoms, and it took a while for a doctor to truly understand what you truly have, restless leg syndrome. And I'm sure that there are many of you who have encountered a doctor who didn't know what restless leg syndrome was or wasn't able to provide a quality treatment plan or really anything that you would expect from a medical professional. So it's our goal with this program to ensure that the medical professional world truly understands restless leg syndrome. We're able to increase their understanding about it, work with them to be better equipped to treat our patient community, to recognize restless leg syndrome, and then for the general population to also understand what restless leg syndrome is, what some of those symptoms are, how to help them to ensure that they're seeing a quality medical professional who understands RLS, making sure that they have available to them resources and know where to turn to for help in their journey, and finding out what information may be helpful to them is greatly important. So we're very supportive of this increased education and awareness program because it now allows us to reach even more people and increase the overall awareness of restless leg syndrome.
Awesome. Thank you so much, Bill. Can these priorities change throughout the year?
Yes, some of them do, some of them don't. So for instance, we have, and all this is laid out in the prep packet, our request for the National Institutes of Health, that funding request of $46.1 billion will remain in effect for the rest of this year as they work through the appropriations process. These are our priorities as of now, but Congress does go through a lot of changes. Last year, there were a number of items that at the beginning of the year, Congress was expected to advance and move forward, but because of the pandemic, a lot of that was sidelined. So my job here in Washington is to keep my eyes and ears out for anything that affects the RLS community and to keep folks updated as things change, if we need to add to our legislative agenda or if we need to rework them. But that's why, and I've said it in a few videos, advocacy isn't just one day or 1 week out of the year. It truly is year round, where we encourage you to develop those relationships with your House member and with your two senators. So that way, if it's November of 2021 and there's a new proposal that's been released in Congress that we are supportive of, we can go back and reach out to those offices that we've met with and encourage them to support this. Or on the flip side, if there's a policy that's been released that is under consideration that would negatively affect our community, we're able to mobilize and activate to engage with members saying that that policy would not be beneficial to our community and urge them to oppose that. So our legislative priorities kind of fit into two categories: ones that are set and follow the annual process, and others that are a little fluid depending on what work Congress is focusing on.
Awesome. Thank you so much for taking your time to share with us this important information in the prep packet and our legislative priorities. Make sure you read the full prep packet to ensure that you have all the information you need to successfully contact your member of Congress. You can watch more of our virtual advocacy videos on our website at rls.org/advocacy. And remember that Virtual Advocacy Week is April 26th through the 30th, 2021. And thank you so much for your time, Phil, and you have a great rest of your day.
You too. Thank you, everybody.